In an article published in Nature, researchers announced that they have developed a drug that avoids harming healthy cells and targets cancer cells. They deactivated a toxic agent named puromycin by adding acetyllysine to the agent. The drug, called Bok-Cac-Puro, remains inactive until it encounters enzymes produced by cancer cells. Histone deacetylase enzymes and cathepsin protease, abundant in cancer cells, are the enzymes that activate the drug. HDACs deacetylate lysine structures to activate the drug. Subsequently, CTSL facilitates the separation of lysine from puromycin, thereby disrupting the protein synthesis mechanism of surrounding cells and killing them. Sulky Lee, affiliated with the Johns Hopkins School of Medicine, says, "Targeting these highly active enzymes in cancer cells with this drug is a very clever approach." What sets it apart from other drugs? Many tumor-targeted prodrugs are being developed. However, it is noted that this drug, involving two steps using HDACs and resulting in toxicity, is a first in this field. Nobuhide Ueki says that if only HDACs are used, the drug will not activate. These two steps greatly reduce the secretion of toxins to non-cancerous cells. The drug exhibits higher specificity, that is, a more focused action on cancer cells, compared to single enzyme-targeted drugs due to its activity and toxicity immediately upon encountering two crucial enzymes in cancer cells. Researchers have shown that Bok-Cac-Puro kills cancer cells in vitro and prevents tumor growth in mice. It has been demonstrated that both in vitro and in mice, non-cancerous cells are minimally affected. Why is it important? The aim of drugs developed for cancer research is generally to kill cancer cells while avoiding healthy cells as much as possible. However, most cancer cells can secrete the same enzymes as normal cells and may have similar cellular mechanisms. Therefore, it has been observed that drugs developed to kill cancer cells can also attack normal cells. Most studies focus on developing prodrugs that are highly expressed in cancer cells and activated through proteases. Additionally, researchers are trying to slow tumor growth by inhibiting HDACs. HDAC inhibitors can also interfere with the functioning of enzymes in normal cells. What Ueki and his colleagues have done could potentially lead to a drug that avoids normal cells more and targets cancer cells more. Ueki says, "We've shown that by using puromycin, we've only proven one. It has been observed that Bok-Cac-Puro specifically targets pancreatic, cervical, and liver cancer cells in vitro." Needs for development. Ueki emphasizes the need for much more experimental work before this drug can be used clinically. He says, "We also need to try to target more cancer cells. Moreover, this treatment needs to be further validated in animal studies with cancer." Matthew Boggio from Stanford University says about this study, "We still don't know how Bok-Cac-Puro turns into puromycin and manages to be specific to cancer cells. Especially, there is insufficient evidence on how CTSL separates lysine from puromycin. Studies have shown that with marker probes, lysine or acetylated lysine is modified and targets cancer cells. When they target cancer cells, the probes emit light. However, they show less activity in the absence of CTSL inhibitors. It has also been shown that the probes are less active in non-cancerous cells." Parenthetically, he mentions that understanding CTSL's role could be better achieved with the knockdown method. Beyond the article, as with previously discovered cancer drugs, they are currently in use. However, one of the fundamental problems with these drugs, as mentioned in the article, is that they not only target cancer cells, but also attack normal cells. Additionally, there is the possibility that non-dead cancer cells may become stronger, or even if we completely eliminate cancer cells, normal cells may become cancerous. It is also evident that even if normal cells do not turn into cancer cells, they may suffer a certain degree of damage, and cancer may recur later. Despite all these drawbacks, every study conducted on cancer drugs, as in this article, provides us with new information. The next stage is sure to be much more effective, and somehow more practical drugs will be produced. Hope you found this cancer treatment video useful by using this drug. Don't forget to subscribe to our channel and turn on notifications for more content. Also, don't forget to share your thoughts and suggestions in the comments to help shape our future videos. Thank you for your support and see you in the next video.